Hi, everybody, and thank you for inviting me to this conference. I'm Francesca Tripodi, and I've been involved in sexology education for 25 years, both at a national and international level, working with different scientific societies and associations. What is online education? It's a procedure of gaining skills and knowledge through digital technologies and devices like computers, mobiles, laptops, etc., using the internet. What are the online environment formats? We have the asynchronous that is effective for students with time constraint or busy schedules. This type of offerings do not take place in real time. Students are provided with content and assignment and are given a time frame to complete coursework and exam. Interaction usually take place through discussion boards, blogs, and wikis, and as a result, there is no class meeting time. Then we have the synchronous, and this enables students to participate in a course from distance in real time. These offerings require the instructor and all the students to interact online simultaneously. Similar in some ways to a webinar, participants interact through text, video, or chat. And then we have the hybrid courses, also known as blended courses, that are learning environments that allow both in-person and online interaction, like we did with congresses in the last years, depending on the availability of the students and the requirements of the specific course. Before COVID, we had some prejudice about education. So we thought that in-person meetings and courses were better than online. But what happened in the last few years? In response to the call for the social distancing, the global higher education community suspended all their in-person meetings, we all know. And this shift to virtual delivery was absolutely unplanned, unwanted, and an easy learning experience, in the sense that many of us were in difficulties to deliver the course online due to the urgency to change the formats and the lack of time for preparation. And therefore, we had some studies that came out in this period that were assessing the impact of this online environment in the education of the health professions. We went through the so-called Zoom era. In the first half of 2021, over 2 billion monthly visitors were on Zoom. And due to the pandemic, Zoom customers base increased of almost 90%. Currently, over 65,000 organizations use Zoom, and the platform is available in 9 countries. And also, we saw the syndrome of the Zoom fatigue, so tiredness, worry, or burnout that were associated with the overuse of virtual platform of communication. Overload also of non-verbal cues and communication that does not happen in normal conversation, and increased average size of group in video call. So all of that caused us a kind of a specific distress. Nevertheless, our interest in online education increased in Europe as well as in other countries and continents, where official figures show that almost 30% of people used it in 2021. And as we can see in this graph, both by taking online courses and using online learning material. Of course, younger people take the most significant advantage of it. What are the pros of synchronous learning? Of course, it provides opportunity for asking and answering questions in real time as they come up, allows spontaneous interaction and exchange between learners and lecturers, provide an opportunity for lecturers to get feedback on participants' learning, adds also the human element that is always very important, builds the classroom community and increase the number of social interaction that, of course, are interaction that are not related to the content of the course. And what are the cons? Of course, asynchronous learning can widen the gap for learners that have certain disabilities, unstable internet access, that have different access to devices and other equipment, that have caregiving responsibility or no access to a suitable space to participate, and we need always to consider the time zone differences. What about the pros of the asynchronous learning? Participants can complete work on their own timetable. That is a huge advantage in today's context. They can take the necessary time to digest and reread content that are difficult to deepen their understanding. Participants also have the time to compose and revise responses in asynchronous class discussion, so increasing access to those with languages and other barriers. And what are the cons? Without a proper motivation, some learners risk to put off completing the course and fall behind. And also learners can feel isolated or disconnected from the instructor or the lecturers and other students. And that's why some institutions suggested integrating different formats, giving specific tips on when to use them better, like the algorithm that you can see here by the Concordia University. So the modern suggestion is to integrate synchronous and asynchronous learning in online environment. So what about us? I did this search last year online I looked for online sexology education, and as you see, I've found around 1,700,000 results, so a massive offer. While the same search a few days ago gave a different outcome, almost 60% less. It means that where possible, providers preferred to come back to in-person education. In all the pandemic period, the role of the scientific societies was really important because they organized webinars and interviews and podcasts to keep members connected and engaged until in-person meetings and conferences were possible. Some of them, and specifically those of sexual medicine, the ISSM, the ESSM, are still maintaining these formats because they are successful. But when it comes to training or professional development, we need to remember that sexology is not a recognized specialty or profession in many countries, many European countries also. So everyone can give courses, and this is very important to understand. Also, another variable that is on the table is that credits are now mandatory in many countries. So it becomes a kind of business to deliver seminars or courses that give credits to professionals. So just to refresh, how we can become a sexologist? We need certainly a bachelor degree and a master degree. Could be, of course, a psychologist or psychology or medicine, but also in mental health, in psychotherapy, in psychiatric nursing, in social work. Some degree that is relevant in the health field. But then you should go to do an internship or a psychotherapy training or a PhD, and then you need to do a kind of period of supervision, and that is very different between countries. And then you should pursue your license or professional certification that in many countries are given by federation or societies that fill the gap of the missing recognition. But what is important here to understand is that you may not even need to get licensed by the state in your countries as other types of therapists do. So it's on you to get other way training in the field. About the best universities for sexology, according to EdRank, we have the University of Amsterdam and the University College of London that are the best. But these universities are currently giving only campus courses and not online courses. If we want to get the big picture of Europe, we have more or less 150 master degrees in gender and sexuality studies. Of those, 8 of those are online or blended. So very few remained online. The duration is more or less 1 or 2 years. The annual fee can vary a lot from free to 30,000 euros. And of course, we came back to private training at a national level. In many countries, private associations give training to sexologists. But as we said, after the degree, the bachelor or the master, you are supposed to continue developing your professionalism by improving your competence and skills. So what can we find online? We have various online modules that are available, both from big scientific organizations like ISSM or private initiatives, private companies. Very few studies assessed the outcome. So several studies have attempted to measure the effect of e-learning in medical practice. However, the results are not conclusive. In this systematic review, the authors analyzed 16 randomized trials assessing the effectiveness of e-learning versus the traditional learning for health professionals. And what they found is that when compared to traditional learning, e-learning may make little or no difference in patient outcomes or health professionals' behavior or skills or knowledge. So this is a kind of surprising result if we take into account our previous prejudice. So how can we orient ourselves into the jungle? How can we choose the appropriate education? We need to, to choose institution or private sectors, private providers. We want to go to those who give importance to knowledge or give importance to clinical practice. We maybe want to choose those who gave a who have a biopsychosocial approach, or that deliver the content in an environment that is multidisciplinary, or we want to know if the faculty is local, which is the common case, or we have a faculty that is international with specific expertise on the topic. So these are my suggestions on what we should look when we are analyzing the online courses on the internet. First of all, the accreditation, then the content, the aim or the learning objective of the courses. I suggest very much to read the lecture CV or the provider CV, just to understand who is going to give us the lecture or the education, the scientific activity of the provider, and so on. Another point is the online clinical supervision. As you all know, supervision is not a lecture, but it is a discussion of clinical cases that aims to optimize the supervisee skills. Supervision can be a synchronous web service where the supervisor communicates directly with the supervisees. In many countries, it's very difficult to find a good supervisor in sex therapy, but very few platforms provide online supervision with accredited supervisor. We can have different formats here. Again, you may want a flexible supervision, so a supervision that goes according to the specific needs of the supervisees. We can find the thematic supervision according to a specific domain of sexology, or a structured supervision that goes according to a specific curriculum that we want to build. So is online sexology education in our future? To my opinion, yes, it's already our present, but there are some critical issues. We should assess them. We should work the motivation for competence, because many of us aim only to get certificates, to get diplomas, but not really to gain or to develop their competence in sex therapy or in sexology or in sexual counseling. Also, another critical issue is the motivation for professional development. So the idea that you in this field, you have always to look at new ideas, to new perspectives, all the changes that are in many areas of our work. Also, we don't really have a culture of continuous education. Many of our colleagues are just sitting in their private office and just assessing patient or treating patient without even going to congresses or conferences. So they remain stable in their level of professionalism. And we also miss a culture of clinical supervision. Many of our colleagues don't know what is clinical supervision, and they may not feel the need of discuss their clinical case with the supervisor. All of that because nothing is really mandatory if you want to call yourself sexologist in your country, in many countries of many European countries. So online education, to conclude, online education increase effective opportunities for sexual health providers, also provides education that is comparable to that provided in traditional learning. And for sexologists, as I said, the continuing education is mandatory as the field constantly evolves. We can't rely only on local providers. We need really to learn from the best, from the legends in our fields, from those who brought important concepts into sex therapy, and maybe they are living far from us. So online education brings those people to you, and this is very important. Otherwise, our clients will not get the best care and will not be the ambassadors of our competence. So I finish with this sentence that I find very provocative, but also true. If you think education is expensive, try ignorance. So thank you very much for listening. Bye-bye.